Good afternoon, excuse me, and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, December the 9th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, thank you and good afternoon. And it's always nice to have some good news, and we did all receive some today, and that Health Canada has approved Pfizer's COVID-19 vaccine. And that hopefully will give us all a degree of hope and encourage us to keep doing the right thing to stop the spread of the virus as much as we possibly can before people have a chance to get vaccinated. My colleagues will have more to say about that today. It also does remind us that our work to help people get through that period and even the period of in the aftermath of the pandemic as it hopefully recedes, that work can't stop. As the pandemic continues and we see the number of COVID-19 cases increasing in our city, it is more important than ever to recognize the toll this has been taking on the mental health of all of us. It's heartbreaking to see the recent stories about people having increased thoughts of suicide, for example, during the pandemic. And I have myself heard from many Torontonians from all walks of life who tell me almost universally of elevated levels of stress and anxiety, which in far more cases than normal have led to a need for outside or professional assistance. And I'm able to report to you today that we did, back in April, in anticipation of some of these kinds of needs, launch the mental health support strategy, where we joined forces with 13 key mental health service providers to ensure that mental health support services were better integrated and that Toronto residents were aware of the free support services that were available to them. In the almost 6 months since then, some 88,500 Torontonians have taken advantage of these services, many of which are available by phone, by text, or by email. Of that number, more than 80,300 people received direct mental health support from a person or organization, and more than 8,000 people were referred by 211 directly to mental health partners for additional support beyond that which could be offered through 211 itself. Preliminary data also indicates that 40% of the people seeking mental health support were seniors, with 3% being young people. To date, 211 has also reported a total of 42,708 mental health-related web searches, including community-based mental health services, addiction treatment, youth mental health, crisis lines, and in-person crisis services. Today and through the holiday period, we are asking Torontonians to limit interactions with friends and family members who don't live with them, and we know that this is a difficult but very necessary ask. Not having physical access to our usual social support networks has been extremely hard for many people and can heighten the feelings of isolation. We understand that. I know the shorter days, the coming winter, and the holidays are also contributing to feelings of sadness and isolation being felt by many. I wanted to take time today to remind Toronto residents that since they don't have to suffer in silence. While we have to stay apart right now to stop the spread of COVID-19, you are not alone if you are feeling these feelings of anxiety and stress, and perhaps worse. We are there to help because this is a natural consequence of this ongoing nightmare for many Torontonians, that they would feel this level of stress and this kind of strain on their mental well-being. Through the mental health support strategy, residents can continue to access free mental health support from the safety of their own homes through the phone, through text or online support. The phone call option is 211. This free service is available 24 hours a day, 7 days a week. Services are available for children and youth, seniors, frontline workers, and those with intersectional identities such as Indigenous, Black, persons with disabilities, and LGBTQ2S, who are struggling with isolation and anxiety. And we've arranged for organizations that specialize and that have special knowledge and ability to deal with people, intersectional aspects of people, to address their mental health issues in particular. We also recognize the impact that this pandemic has had on frontline workers who continue to provide important supports for Torontonians during the course of the pandemic. They've carried us through the pandemic in ways I think we all understand much better than perhaps at the beginning. They've worked tirelessly for 10 months, and they know that there's more of that kind of work that lies ahead. And for this reason, specific mental health resources have been mobilized as part of the city's mental health support strategy to support those frontline workers. Frontline workers with minimal or no mental health coverage are encouraged to call 211. Note that they're a frontline worker in need of mental health supports, and they will be connected to specialized counselors free of charge. They have not let us down, our frontline workers, and we will not let them down. The City of Toronto has also created a mental health section on toronto.ca that is filled with helpful advice and resources that people can access beyond 211. We know this isn't a substitute for a properly funded mental health system, and we continue to urge the province in particular to invest more in that crucial part of healthcare which has historically and presently been underfunded. But we're doing everything we can as a municipal government to help people get through this pandemic and to protect their health, including their mental health, but all aspects of their health at the same time. Staying active safely is another way that people can contribute to maintaining their mental health and well-being, and that's why the city, based on advice from Dr. Davila and her public health team, continues to encourage people to get outside safely, to get some fresh air and exercise, to maintain both their physical and their mental health. And it's why we created the Welcome TO Winter Plan as well. I encourage anyone who feels lonely or isolated or anxious or depressed or who knows someone who is struggling during this pandemic to please reach out for help or even reach out on behalf of people that you know are struggling in this manner. These kinds of services at 211 are free, they're safe, they're confidential, and they're available for anyone who needs that help. And please remember, it's okay not to feel okay. You've heard Chief Pegg say it before, and I hope if you aren't well in this way, you will reach out to someone to get help. Now, our work to roll out the updated and enhanced set of targeted COVID-19 measures to help the city's most vulnerable residents and communities during the lockdown continues. That includes our work to support provincial testing efforts, which have not necessarily been in the right places or the right times or the right quantity up until now. We've opened city facilities up to community health partners so that they can provide testing clinics in neighborhoods facing higher COVID-19 positivity rates. We have 146 COVID-19 testing dates at city facilities, including pop-up testing sites at the Oakdale Community Centre this afternoon and the East York Community Centre today as well. And we have mobilized decommissioned TTC buses to have mobile testing clinics. Through a partnership between Toronto Paramedic Services, the TTC, and the Central Local Health Integration Network, or LIN, we will have mobile testing sites up and running in areas where we know they can make a difference in these buses. The first 2 buses will be out tomorrow in the Elms Old Rexdale area. One will operate from 10 a.m. to 2 p.m. and the other from 3 p.m. until 7 p.m. The Paramedic Services officials estimate that these buses can test up to 100 people a shift, and they will be operating in places within these communities where there aren't testing sites nearby to make getting tested easier and more accessible. It's just common sense. We want to help the province increase the testing of the right people in the right places at the right time, which is now, so that we can stop the spread of the virus, and we know making these sites as easy as possible to access will help in that regard. We're also working with the TTC to make sure that in hotspot neighborhoods, we are adding extra buses to achieve greater physical distancing on busy routes. We know this won't always be possible at the busiest times of the day. That's why we brought in the mandatory mask rule on the TTC. But we are working to get as many buses as possible on the busiest bus routes. That's why we brought back every single TTC worker we could, despite the fact that ridership remains at unprecedented low levels. The TTC is putting out more service on many of the busy bus routes than was in place prior to the pandemic. I think that's important to underline. There is more service on those busiest routes than was the case prior to the pandemic. Among the routes receiving this extra service are the 36 Finch West, 35 Jane, 102 Markham, 54 Lawrence East, 29 Dufferin, and 41 Keele. Yesterday, TTC CEO Rick Leary updated the chair of the TTC, Councillor Jay Robinson, and myself on this ongoing work that is continuing to ramp up to reduce crowding for residents on the busiest bus routes. Resources are being reallocated from lower routes with higher ridership demand, such as 35 Jane and 54 Lawrence East. To further reduce crowding for customers, the TTC restored express bus service on busy corridors, like on Jane Street and Lawrence Avenue East. The TTC's 2021 annual service plan is being released today and goes to the Commission for approval next week. And the plan will make sure that the TTC will continue to restore express bus service, to add more capacity, and to reduce crowding for customers. The first phase of service restoration in this regard will begin in January, when express bus service will be restored on more corridors, including Finch Avenue, Keele Street, and Don Mills Road. Beyond January, the TTC will focus on optimizing capacity by balancing service levels across the city to ensure capacity matches demand and customer crowding is minimized wherever possible through the means that I identified earlier. Mr. Leary assured me in our meeting and assured the Chair that the TTC will continue in 2021 to closely monitor on a daily basis ridership and adjust service where needed as often as we possibly can, but the message has been received and it's all hands on deck. So much so that right now the TTC is actually retraining subway and streetcar drivers who had not previously been trained on how to drive a bus. They are presently retraining subway and streetcar drivers to drive buses over the next couple of months, and that will help us to put more buses on the streets in the new year. I want to thank our frontline TTC employees for the work they have done throughout the pandemic and the work they're doing today to make sure that the TTC remains what it is, a safe and convenient way to travel in our city. Finally, for today, it is Wednesday, and I really want to encourage people very strongly to take advantage of this day, or to take the opportunity to mark this day, Takeout Wednesday, to support our restaurateurs who really have been struggling during the unusual circumstances presented by the lockdown. For those who can place an order for takeout or delivery, this will make a difference. And I know not everybody can, but there are lots of people who can and who do anyway. And please take a moment to place an extra order, if you possibly can, to help restaurants and bars get through this ordeal. You don't have to cook. You can order a drink from them too if you want. And if anybody gives you a hard time, you can just say that you're following city advice in patronizing these restaurants through takeout or delivery. It sounds like a triple win. And on that note, I will ask Dr. Davila if she would provide her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I'm reporting 553 new cases of COVID-19. There are 220 people in Toronto in hospital with COVID-19 and 53 in ICU. Amongst the 553 reported cases today, 70% are spread comparatively evenly across 4 age groups. 116 cases are amongst people aged 20 to 29 years, 96 amongst those 30 to 39, 80 amongst those 40 to 49 years of age, and 99 cases are amongst those aged 50 to 59. Understandably, there is a desire in many people to have more facts and data about COVID-19 in Toronto. Starting today, there will be new information on our COVID-19 dashboard about percent positivity for COVID-19 by age group. Percent positivity measures the proportion of individuals testing positive for COVID-19 out of the total number who've been tested. There are 7 age group categories which we track. In the new data, you will see that the percent positivity is highest in the category of young people aged 14 to 17 at 11.6 for the week of November 22nd, the most recent week for which we have the most complete data. That's more than 2% higher than the percent positivity for the next highest group, and these are 18 to 23-year-olds at 9%. I see this as a reflection of the widespread of COVID-19 at this point in the resurgence, and an indicator of just how easily this virus transmits from person to person. For some time, Toronto's R number, the effective reproduction rate, has also been on our dashboard. Today, it is 1.1. And this means that new cases result from each new case that is confirmed. Below 1, it's the opposite. So an optimist would say that we're fortunate to be so close to the position that we can turn these numbers around. A pessimist would say that we're on the wrong side of where we want to be, and, if not heading in the wrong direction, at least stalled. These two things can be true at once. You will also find on the dashboard our 7-day moving average for new COVID-19 cases, which today is 506. This time last week, the 7-day moving average was 454 new cases. A week before that, it was 418. 5 of the 9 days this month have seen case counts exceed 600, typically in the mid-600s. One day saw 761 cases. We are a little more than 2 weeks into the 28-day restrictions designated for Toronto by the province. That the daily case counts may be settling suggests the early results of the restrictions are emerging. But what is clear today is that case counts in the mid-500s or into the 600s on any given day are in no way a good thing. Additionally, we are continuing to see new hospitalizations, and so bed occupancy in hospitals can be expected to rise for at least a few more weeks. This puts more pressure on the healthcare system, both to provide care for COVID infections and to provide care for anyone else who needs it, whether for other physical or mental health needs. It is important to remember that illness that results from a COVID-19 infection cannot be predicted. It is likely to be a mild illness in most people, but it is not guaranteed. It may spread from a person with mild illness to another, who will suffer severely and possibly even die. There are many variables, best measured in trends over time, rather than day by day, and it takes time for trends to emerge. For now, and for the foreseeable future, we have to live with what we do know, that COVID-19 is spreading widely in Toronto while we are in the holiday season. These levels of infection clearly indicate that we must be on high alert and that we are best to follow the provincial guidance and celebrate this month just with the people we live with. Hanukkah begins tomorrow night and continues until December the 18th. A week later is Christmas Day. While the Jewish and Christian faiths probably touch the widest number of Torontonians, December is a high point of the year for Toronto's many cultures, faiths, and families. It's hard to break with tradition, even once. But the best and safest decision for those we love is to break with it just this once. In protecting ourselves, we also protect the people who matter to us most. So please, stay home as much as you can. Please keep the people at home limited to the people who live there, and please apply this limit to your celebrations this year. When you can't stay home, stay safe. Keep a good distance, wear your mask, and wash your hands. It was put to me the other day that this year, the spirit of the season will be seen less in what we do and more in what we don't do. Today, as stated by the Mayor just now, Health Canada approved the Pfizer vaccine for use in this country. We are also seeing encouraging news elsewhere in the world with vaccination now underway in the United Kingdom. The momentum is finally, but slowly, beginning to favor us and not the virus. But there is a long way to go. We must not lose sight of the current risk and threat of COVID-19 infection. Vaccines are emerging as part of the solution, but they are still months from providing the solution. There has never been a time in the pandemic where it is more important to limit as much as possible our contact with others and to focus on what's in front of us so we can get through it to better days ahead. There is a real risk January could be extremely difficult for us in terms of COVID-19 related illness if we gather together as usual this month. However, if we make up our minds to celebrate differently and to keep apart rather than to gather together, it is entirely possible to limit the degree to which COVID-19 will continue to spread. With that, I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. Since the outset of COVID-19, the City of Toronto has built and operated robust and nimble incident management systems, which have enabled us to both plan proactively and respond effectively to COVID-19. In keeping with our commitment to ensure that we are well prepared, the City created and launched the COVID-19 Immunization Task Force to ensure that we are ready to deliver for Toronto residents. The COVID-19 immunization campaign will be the largest such deployment we have ever seen. More importantly, it also represents the light at the end of the tunnel that we are all so eagerly awaiting. Mayor Tory and I were on a call with Premier Ford and General Hillier this week, and were advised that the first doses of the vaccine will be received and administered by the province of Ontario. The delivery of the COVID-19 immunization campaign requires the well-coordinated work of all three levels of government. The Government of Canada is responsible for approving, procuring, and distributing COVID-19 vaccines to each of the provinces and territories, and of course, in our case, to the province of Ontario. And of course, we're all very pleased to learn that Public Health Canada has now approved the Pfizer vaccine for use in Canada. The province of Ontario is responsible for receiving approved vaccines from the Government of Canada, establishing the vaccine distribution priorities, and distributing the vaccines across the province. Once the City of Toronto is provided with COVID-19 vaccines by the province of Ontario, we will be responsible for the administration of these vaccines in accordance with the prioritization framework that will be provided by the province of Ontario and under the authority of Toronto Public Health. We are directly connected with the Provincial Immunization Task Force and are working together to ensure an efficient and effective administration of vaccine for Toronto residents. The very core of the COVID-19 immunization campaign in Toronto is the establishment of public trust and confidence in that we are able to deliver for our residents when that time comes, and I have every confidence that we will meet that objective. The City of Toronto will be ready to go without delay once vaccines are made available. As the information relating to the COVID-19 vaccine develops, toronto.ca/COVID-19 will be your best source for credible information. As I conclude, I would like to thank Mayor Tory for drawing important attention to the issue of mental health. Undoubtedly, we are all feeling the impacts created or exacerbated by these abnormal times, and feelings like frustration, anxiety, and fear are normal reactions to abnormal situations. It is okay not to be okay, and seeking out help, both to stay healthy or get healthy, are signs of true strength, not weakness. Thank you for drawing attention to these important issues. Thank you.
Thank you, Chief. Before we go to questions, just a reminder, reporters, to please unmute yourself so that we can hear your question. We also have a number of staff on the line should you have detailed questions for them. And we'll go first to Austin Delaney from CTV News. Austin, go ahead.
Hi, my question is for Dr. Davila, and if the mayor would like to comment as well. It's on mobile testing, its importance, how big a role will it play in flattening the curve? Thank you.
So I'll start off with that first. I think providing access to testing is an important component of the fight against COVID-19. The first step in actually addressing specific COVID-19 infections is to identify that they occur in the first place, and that all starts with a test. And by providing access to tests and making testing more readily accessible, particularly to parts of the city or to people within the city who have more challenges in terms of accessing testing, it is certainly a step forward and a key step in fighting against COVID-19.
I will just say that we've been very happy and very proud as a city to support the province in trying to improve the testing efforts, both by making testing more accessible, because we found that there were a lot of people who didn't know or who were very anxious about getting tested, didn't know how, were afraid of losing a paycheck. That's still an issue that hasn't been addressed properly by other governments. But doing things like configuring and rolling out buses to provide for mobile testing is something we've done to assist the province, and they've worked with us in doing that. And I hope that will lead to more accessible and better testing. And I think we also have some work to do. Again, it's mainly their responsibility to get the turnaround time for those testing results up, because the faster we have the results, the faster we can get to work at figuring out the root causes of that transmission and addressing that as well.
As a follow-up, do you think this will have a real effect in those hardest hit areas? Is this a game changer for those areas?
Well, perhaps I'll start with that and say that I think it's certainly part of a more comprehensive solution. And you heard the mayor make reference to some other things that are important. People need to know that should they get diagnosed with a COVID-19 infection, that they have some protections and that they are still able to provide for their families, whether it's through income supports and protection in terms of ensuring that they have employment to return to once they have that opportunity to recover from that infection. I think as well the mayor made mention of the importance of laboratory turnaround time. Yes, it starts off with having a test, but the more timely we are able to get results on those tests, the sooner we can get to work on understanding who else might be at risk and from whence the disease came from. Again, all part and parcel of the many parts that are required in responding to the COVID-19 pandemic.
You know, Austin, you have to ask yourself this question. Why should it be the case that any resident of Toronto should be left much more vulnerable to COVID-19 than any other? And so if it means we have to put buses that we've reconfigured to drive them right up to the door of apartment buildings or community centers or anywhere else, frankly in the middle of the neighborhood if that's what works best, if it means we have to have pop-up sites at community centers and so on that come up to make it easier for people to get tested, if it means, as we've done with the help of the Government of Canada, to put in place an isolation facility so people who test positive can not go home to an apartment and potentially run the risk of infecting 6 other family members but can go somewhere else, that's the right thing for us to do, and that's what we have done as a city, working with the other 2 governments, and that's what we'll continue to do.
All right, thank you. We'll go next to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thanks so much. My first question is for Mayor Tory. It's regarding comments that you made recently that discussions need to start soon on whether Toronto's lockdown will be extended past December 21st. So are you suggesting that even preliminary discussions have not been taking place? And when do you expect these discussions to begin, and when do you expect to have an answer by?
I think my answer really wasn't, may have been in response to a question about extending the lockdown, but I think my answer also covered the fact that even if the lockdown ends on the day that is specified, businesses and other organizations need some notice. You know, if you're going to reopen a business, you need to disinfect it, you need to bring your staff back, you need to get your inventory in place. And so the point I was making was whether the lockdown ended on the day as scheduled or some other day, there has to be adequate notice given of that. And I would just say to you that discussions go on every single day between the public health officials and between the elected representatives about how things are going. And what we have not done is begun to speculate publicly on maybe this, maybe that. We've just carried on with those discussions. I hope people will recognize, as I do, and I think they do, that some notice, regardless of the outcome, is required in order to make sure that people and businesses are properly informed well enough in advance.
That's great, thank you. And my follow-up question is also for you, Mayor Tory. We wanted to circle back on comments you made on The Rush with Ryan and Jay last week regarding thrift shops, and you were looking to maybe make a push to have them reopened. So where are you at with that? Are you being given anything from the province that thrift shops may be able to reopen?
Well, the regulations say what they say, and I think the real distinction here isn't between a thrift store and another thrift store. It's between a thrift store, which may well be just a store where people buy things, maybe at a lesser price, and maybe they're used, as opposed to organizations that give away things or largely give away things to meet people's necessities, such as clothing in the winter months. And so I think what's going on now is more of a case-by-case examination of exactly what these things are, because it's hard to distinguish between a so-called thrift store that actually sells things, resells things, even though the benefits may go to charity, and an organization that actually gives things away. So I think that the public health people are quite properly handling those things on a case-by-case basis and trying to make sure that people have access to places where they can get the necessities of life, which of course include clothing in our climate.
Thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead.
Hi, good afternoon. I've been speaking with a retail store owner in Midtown who says that the same bylaw officer keeps coming by to tell him that he can't put out his greeting card spinners on the sidewalk or even a small table. He's trying everything he can do to sort of get around the retail limitations, and points out that around the corner is a hardware store where there is plenty of stuff on the sidewalk. He's not impeding the sidewalk for people trying to get by. My questions are for both Chief Pegg and Carlton Grant. I'm just wondering if there is a directive to tell people to stay off the sidewalk like this, or if there are some exceptions that could be made for retail owners. And to Mayor Tory, I'm just wondering, when the city is trying everything it can to help out retail locations and has already had a track record of helping out restaurants by expanding onto the sidewalk, why they couldn't consider to do something like this as well?
Well, you've asked a question of about 4 different people, so you might get answers, but hopefully they're consistent with one another. What I want to say is this: the law is actually the law. And so, theoretically, there aren't a lot of things that are allowed on sidewalks on a regular basis. However, it is my hope, and this is me not speaking as someone who is in law enforcement or directs law enforcement, but that people, will be reasonable at this particular point in time, and I hope they're trying to do that. But there are people who, and I've seen it with my own eyes, take advantage of that and have it such that you can't even get by on the sidewalk, and I think most people would understand that's not acceptable either. So I think we have to start from the premise of what the law says long before there was a pandemic, and then move to some kind of, as we've done in many areas, including parking and so on, move to something that's perhaps more flexible and accommodating in light of the circumstances. But on that note, I'll turn it over to Chief Pegg and to Mr. Grant.
Thank you, Mr. Mayor. I think all I will comment to is the example that you give indicates to me, or I really see that as one of the complexities that our enforcement team have to deal with every day. And we've often sat here and talked about the fact that there is no blanket answer to enforcement. Each and every complaint and circumstance needs to be fully investigated and then assessed on its own merits against the provisions of law. And I think that what I just heard you describe, which is, frankly, I'm not aware of this particular circumstance, but I think that's what it represents. I think Carlton is available.
Yes, yeah.
Brad?
Carlton, can you add to that, please? Thank you.
Sure, Matt, and thank you for the question. So I'm not familiar with this particular address as well, but it is something that Mayor Tory is correct and Chief Pegg are correct that the sidewalks are not intended for this purposes. There are rules around marking displays, etc. We need our sidewalks to be accessible. We need our sidewalks to be able to be cleared of snow We don't want to hinder business, but we also need to understand what the purpose of that sidewalk is. So we will look closely at this one. Again, it is not our intent to keep going back and harassing people, but we do need people to comply with the rules as has been stated. And again, I understand the fairness issue and the challenges that small businesses are having compared to other businesses that may be around the corner. So we do understand that. We do look at, as Chief Pegg says, look at each of these one by one, and we will look at this one as well.
Okay, thank you, and thank you to all three of you. My second question is in regards to the holidays. And Dr. Davila, we've been hearing about some people who are considering quarantining for 14 days so they can spend time with their family. I know we've heard advice on this before, but I'm just wondering if you could once more provide a little bit more clarity on whether that is good enough.
Well, you know, I think there are certain circumstances that are unique from family to family. And you may recall that when I was giving advice the other day, in keeping with the provincial guidance that's been put out there around the holiday season, one of the circumstances in particular that many families are dealing with right now is the return of family members who are students studying away from the city and need to come home because they can't stay at their university or college over the course of the holiday season. So for those individuals in particular who need to come home, certainly having some kind of period of quarantine in advance is a wise move in order to limit the possibility of the spread of COVID-19. But fundamentally, the advice is this: as much as possible, we're asking people to stay at home and to limit their interactions. Only celebrate the holiday season, whatever way you celebrate, with the people that you live with. Again, there are certain circumstances where we have students returning from university or college or study away, and they can't stay at their residence or dormitory, so they need to come home. The safest thing that can be done in those circumstances is for them to quarantine and isolate as much as possible in advance of coming home, so as not to bring COVID-19 home to the greatest extent that that risk can be reduced. Other than that, it's limit your interactions to your household to the greatest extent possible. Go out only when you have to, and if you have to go out, to stay safe by keeping your distance, wearing your mask, washing your hands, and of course, staying home when you're sick.
Thank you. We'll go next to Francine Copen from the Toronto Star. Francine, go ahead, please.
I'm wondering, following up on Matt's question, is there an enforcement piece to this don't get together on the holidays, or it's not something that is going to be enforced in any way, shape, or form? There's no way to enforce it.
So, Francine, I can certainly start off with that, and I admit I am not an enforcement expert by any stretch of the imagination, but we do live in a rather large city, and we know that you heard the mayor just comment that the law is the law, and there are certain rules that have been put out under provincial guidance. We do live in a big city. It is, I think, impossible for enforcement individuals and enforcement people to be in all corners of the city simultaneously trying to enforce any given rule. And so we're relying on the people of Toronto to follow the advice which is really given in the interest of their own health and the health of those around them that they love. And we've seen that Torontonians have been able to take that advice and actually really apply it. We've seen that over the course of the past several months. And I think that Torontonians, many do recognize and agree that these measures do make a difference, and they recognize that it isn't meant to take away from the joy of the season, but rather to ensure that there are seasons of joy ahead of us for ourselves, for our families, and for our communities.
You know, I think it's really important that we should be honest with each other about this. I mean, there's almost 1 million households in the City of Toronto, 1 million households. We have, what, 4,800 police officers. We have a few hundred bylaw enforcement officers. If we deployed every single one of those people and tried to recruit between now and Christmas a whole bunch more, and I don't think anybody's advocating we should do that, even then, it wouldn't be possible to go around, nor would it be the kind of city we want to live in where people are going around and knocking on doors or counting cars and people's, out in front of people's houses or whatever. And so we just have to rely on people, like everything else. We have to rely on people to decide this is in the interest of themselves, their family, their neighbors, their coworkers, their friends, and that we want this nightmare to be over with. And so, you know, when you say, is there a big enforcement push going to be put on, if you think about it, it's not really practical. We have to sort of count on people to enforce the law on themselves, which is true of most laws most days. People follow the law because it's the right thing to do.
Chief, did you want to add something?
Francine, the only thing I can add, and I certainly concur with what Dr. Davila and Mayor Tory have said, as you know, and as literally as we sit here, we have continued to, throughout the COVID-19 pandemic, operated our coordinated enforcement team. I can assure you that we are prepared to receive incoming complaints relating to concerning private gatherings. That can happen, or that happens through 311, and our coordinated enforcement team will receive those. They'll be prioritized and responded to on a triaged basis as normal. So as the Mayor said, we're never going to be on every street corner or in every home, obviously, but the coordinated enforcement team continues to operate. We'll continue to receive those complaints and do our very best to do all we can to protect the health and safety of our residents.
My second question is for Chief Pegg. When will we get a timeline, a sense of when vaccinations are going to start in Toronto?
Sure, thanks, Francine. So I think, as we can all appreciate, this is a very rapidly evolving issue. And as you heard in my remarks, and I can confirm again, we are directly connected with the Provincial Immunization Task Force. I am directly connected with General Hillier. And I think what we saw today, by way of example, with the announcement that Health Canada has approved the Pfizer vaccine, is but one example of how fast this issue and this landscape, if you will, is evolving. I will say that as that evolves, I have every confidence that General Hillier and the Provincial Task Force will provide us with that information as soon as it is confirmed and available. Until then, what I think what the best I can provide you is to say that we, on behalf of the City of Toronto's Immunization Task Force, will ensure that we are ready to go as very soon as the province provides us vaccines. And in the meantime, we continue to be here to help. We are, as I said, in direct contact with the province, and we will remain directly contacted to do everything we can do to ensure that that happens in as expeditious and efficient a means possible. And when the good day comes, when we are able to begin vaccine distribution and administration here in the City of Toronto, we'll be ready to do that.
Okay, thank you. We'll go next to Jane Stevenson from the Toronto Sun. Jane, go ahead.
Unmuted now?
Yes, go ahead, Jane.
Sorry, yeah, someone just asked I had a question about the vaccine and the timetable. I don't know if Chief Pegg could elaborate a little bit more on the timing. Do you think we're talking days, weeks, or would you venture a guess?
I actually won't venture a guess, just from, I would say, out of respect for the fact that this, as I just said, this is evolving very, very quickly. And I'll draw us back. If we think back over the course of COVID-19, we went through periods of time in our response where the situation in the landscape, if you will, were evolving hour to hour and sometimes day to day, but we often saw circumstances more rapidly than that. Today is an example of where that is evolving very quickly. And I expect to be in contact with the Provincial Immunization Task Force later this afternoon. There has yet to be a day when I have not been in conversation with General Hillier at least once, and generally many times. And I would say as that information gets finalized at the provincial end, once they make those decisions, which are theirs to make, that information will be provided to us and we'll be ready to respond.
Thank you very much. And just a follow-up for Dr. Davila. You said at the beginning of the press conference we should remain on high alert. There was an Angus Reid poll that said as many as 30% of Canadians plan to leave, venture outside of their household for holiday visiting, and as many as 10% out of their community and or province. Do those kind of figures Are they disheartening? Are they upsetting to you? And what can you say to people to convince them that this is dangerous behavior?
Well, I think first and foremost, I would say that given that it is December the 9th, there is still time to change the plan. And the safest and the best option for all of us, for any one given person and for their family around them, is to actually stay home as much as possible, right? To only go out of the home when it's necessary. And when you have to go out, to stay safe by, keeping your distance, wearing a mask, washing your hands. These steps for self-protection that we've talked about for many, many weeks and in fact months now. These are the steps that we know need to be taken. And why is that? There are so many reasons. There's one's own health, because we know that COVID-19 infection can result in very serious outcomes for individuals. Sometimes it leads to hospitalization, and unfortunately, as we've seen far too often, it can lead to death. We are still learning quite a bit about this infection. Increasingly, we are hearing more and more about individuals who recover from COVID-19 infections and perhaps never require hospitalization or significant medical intervention like that, but continue to suffer some form of symptoms, ongoing symptoms and issues related to the COVID-19 infection that they had weeks and months even after the infection. And we have yet to really understand what the longer-term horizon is for these individuals, because we're still dealing with a relatively new virus, that we've known about for just about a year now. So I'm hoping that all that put together actually helps people see that there is good reason for the advice that's being offered. And we have seen many, many Torontonians take advantage of that advice and follow that advice as the route to good health and health protection for themselves, their families, their friends, and the community around them.
Thank you. Final question is to Greg Ross from CBC News. Greg, go ahead.
Hey, my question's about, I know we talked earlier in the week about the encampments and some of the issues. There was another big fire at an encampment near Lamport Stadium last night. I know this was something Toronto Fire had said earlier on in the week that as of, I guess, Monday, there had been 226 fires this year, which was up well over 220% over last year for these types of fires involving people who are sleeping outside. I'm just wondering, is the city growing concerned as the weather continues to drop that people are going to be looking for ways to stay warm in those tents? And does something need to be done to make it safer?
Well, I'll start. I can tell you that, yes, we are very concerned, and certainly in my capacity as the fire chief, I'm extremely concerned that the number 226 as of today is now 229 fires and encampments that we've responded to date in 2020. And as you pointed out, yesterday afternoon we responded to a very serious fire in the Lamport Stadium area. I'm very saddened to say that there were two occupants of a tent that were significantly injured, one very seriously who is in hospital. It is by sheer, I would say, good fortune that there was a community safety team, members of a community safety team from the St. Felix Respite Center who were in proximity to that area when that fire began, and they were actually able to rescue 2 people out of that tent, literally saving their lives. And I will say that they did so at significant risk to themselves. As I said, one of the occupants seriously injured, one fortunately with minor injuries. As a result of that fire, there were 4 explosions over the course of the fire. We later determined or discovered the remnants of no less than 3 propane cylinders inside that tent, along with a number of other articles that included mattresses and, of course, the tent and tarps and smokers' materials and other items. So suffice it to say, this continues to be a very pressing issue, not only with the tents, but also with the polystyrene-based foam pods and domes and makeshift shelters This is a top priority for the City of Toronto from the outset, and of course every year, not only in COVID but now. We have Streets to Home teams and our teams from Shelter Support and Housing that are working diligently every single day, doing all that we can do to look after our most vulnerable residents and bring them indoors into what represents really the only safe and appropriate option for housing, which is safe indoor housing, not makeshift housing in encampments or in parks and stadiums and the like. Brad, I'm not sure we may have.
Yeah, I'm going to ask Marianne Bedard from General Manager of Shelter Support and Housing, Greg, to add to that. Marianne, please.
Okay.
Thank you for the question. I think I'd like to start, obviously, by hoping that the two people who were injured last night recover quickly, and to offer our deep and sincere thank you to the St. Felix Community Safety Team, who were so responsive in this event. Our Streets to Homes team worked really collaboratively with the fire department. After learning of this fire, we made sure that we had teams on site, connecting with all of the residents in that encampment, offering available space. And, you know, this is a complex issue. After the event last night, nobody at that encampment accepted the offer to come inside. So, you know, we remain, you know, concerned about safety of people in encampments. We continue to focus very much on working with people who are staying outside, understanding what their needs are in order to bring them inside, and having those collaborative conversations with the agencies and concerned parties that are supporting people who are in encampments to try to make sure that we are working together on an appropriate response to the situation.
Mr. Mayor?
Okay.
I would just like to say one more thing. One of the things that I think it's very important to note is that our shelter system, thanks to the hard work of the staff and the measures that have been put in place and the extraordinary job that was done in moving thousands of people into alternate accommodations, the shelter system is safe. It is safe. It is actually quite remarkable, given the number of people that are sheltered and supported every night, how few instances there have been of COVID-19 outbreaks in that system. And so there are people who discourage those who are living in encampments from going to the shelters on the basis they're going to get COVID-19. It is not true. I mean, nothing is impossible. You can get it anywhere in the city if you don't take proper care. But the shelter system itself, thanks to the Herculean efforts of the staff and the movement of many, many people to alternate accommodations, is safe. And I would hope that more of the people will take up the offer that is made by the Streets to Homes team to take advantage of the hundreds of spaces that do exist today in different forms to offer shelter to people so they don't have to stay in the encampments.
May I
You wanna add
just,
something?
sorry, it's
sorry.
I'd be negligent if I didn't close off with which giving you a quick update as to some of the additional things that have happened. Marianne spoke about the collaboration between our teams, and I think it's important for everyone to understand that in response to this issue, we are as of yesterday, again, this is the second increased response or increased protocol in as many weeks. We are actually, Toronto Fire Services is increasing the number of firefighters that we are sending to reported encampment fires, and that is indicative of the risk and hazard that we're seeing. Secondly, we are again increasing the public education efforts alongside our city partners, certainly including Streets to Homes, that is being taken. Public education is a key aspect of the way that we are responding to this situation right now, and we're doing everything we can do to make sure that the occupants and residents of the encampments are aware of the hazards. And lastly, we are, when I spoke to the fire services team today, they are embarking upon an effort to pre-plan, which is physically pre-surveilling or understanding in advance, if you will, pre-planning all of the known encampments across the city, and we will provide and update that information within our computer-aided dispatch system so that our responding crews have the most up-to-date information such that the emergency response to encampments can be as fast and robust and efficient as possible.
I know, Greg, you have a follow-up, so go ahead.
Yeah, just a quick follow-up. The point was made that even last night, after that big fire and the 3 explosions, that all of the rest of the people that were in that encampment did not accept an offer for shelter. And I think that's one of the problems that we're seeing with people that are still in these encampments or living in tents, is they don't want necessarily to deal with, for whatever reason, either the city's shelter system or some of these hotels that are being offered as housing. But one advocate said, why doesn't the city do more to provide them with more adequate survival tools when they're living, particularly when it's going to get cold, like fire retardant sleeping bags or fire extinguishers, and maybe even a little bit of training in terms of how to deal with these kinds of fires. Is that something the city would consider?
So we have looked at all of those options. It's a very difficult thing to answer in a short and concise means, but I'll do my best. The issue is far more complicated than the simple provision, or what seems to be simple, and we could provide things like fire extinguishers or training. The reality is this: the materials that are collected commonly, that are collected and stockpiled, if you will, in encampments, represent an immediate threat to life. And that is things like we saw last night with compressed gases like propane and other materials. So simply providing what the things you described, frankly, would not mitigate the risk. Fire extinguishers are always an interesting discussion. We have these discussions around whether or not we should be expanding their use or expanding the amount of training we do for people in homes as well. The issue is this: if you find yourself in a tent or in one of the polystyrene domes or the small makeshift shelters, and a fire ignites, I can tell you from personal experience, there will be no time to escape, let alone look for, find, and deploy a fire extinguisher. The only way that we are going to keep people safe in those environments is to eliminate those hazards from fire and to do everything, continue to do everything that we can do to move those folks who represent some of our most vulnerable residents out of those encampments into safe, well-equipped indoor accommodations that is appropriate for human life safety. And that's where we're focusing our effort. Marianne spoke to that, and that is precisely where we will continue to focus.
And I'm just going to let Marianne follow up on that and all that we do out there to protect people, especially in the winter. Marianne?
Thank you, Brad, and thank you, Chief, for your comments. And I think that's the key piece of information, that the city is focusing our efforts and our resources to help people come inside. We started this press conference speaking about the importance of mental health. It's a significant issue with many people making the decision to stay outside as well as having active addictions. So we continue to have conversations with our provincial partners who have jurisdiction over both mental health and addiction services, to try to make sure we bring more of those services to people in order to help them make an informed decision about their housing, and in hopes that that will support people to make the decision to come inside.
Marianne, thank you very much, and thank you for joining us, everybody. That concludes today's briefing. Please stay well.